So I'm here today with
Diane Chandler.
Diane Chandler. And I'm excited. I was talking to Diane earlier before our visit, and I just like, what brought you into our office?
Well, what brought me in was I was having a lot of pain in my body, but especially numbness in my feet.
Mm-hmm.
So I really wanted to try to deal with that, that sensitivity and that pain in my body.
How long did you have it before you came in?
Probably about 4 or 5 months.
Okay. In the feet or the whole body?
Predominantly in the feet.
Okay.
But in the whole body, the pain was as well, but predominantly in the feet. It was the worst.
Okay. Were you ever diagnosed with peripheral neuropathy before you came in? Have you seen anybody else before you came in the office?
No, I was actually seeing a rheumatologist.
For what?
For autoimmune disease.
Okay. And how long have you been seeing your rheumatologist?
Probably about a year and a half.
And you were seeing her for what kind of pain?
Actually, I was seeing them because of the autoimmune,
Right.
and then that's when the pain developed, and we started on some medication for that, for the pain.
4 months ago for the medication?
No, medication was probably about 8 months ago, 8 or 9 months ago.
Okay. I hate to do a full history, but I'm gonna ask.
Mm-hmm.
So you saw the rheumatologist for pain you've been seeing her for a year and a half for an autoimmune problem. She had you on medications for about 8 months.
Mm-hmm.
How was that medication helping your pain at all?
Actually it wasn't, and that's probably one of the reasons why I was seeking other things, was because it progressively was getting worse to me.
Okay.
It wasn't getting better, and so the medication doses was going up.
Right.
But the pain wasn't coming down.
Okay. And then you come into our office.
Yeah.
And you came in the office with maybe the diagnosis of peripheral neuropathy.
Mm-hmm.
And what kind of treatment have we been doing with your feet since you've been coming in?
Just
your feet?
We haven't been doing anything with my feet.
Nothing?
No.
Good. Oh, thank you. Yeah. So, but how are the feet doing now?
Feet are actually doing good.
Yeah?
Really good. I'm really impressed with how much that has diminished.
Right.
Yeah.
And how about the pain through your whole body?
Actually that's diminished as well, but like I said, because my feet bothered me the most,
right,
I really appreciate just being able to come down the steps, where before I was going one leg at a time.
Right.
Now I'm almost,
right,
going faster.
Oh, good.
Yeah.
That's exciting.
Yeah, I said that to my husband. I said, did you hear how quickly I came down the steps this morning? So he was like, no. I said, well, I would do it again.
That's neat. I like that. So and not the whole thing that we're doing with you, but what are we doing with you?
We've actually we've done dietary changes,
right,
major dietary changes, which I needed. Mm-hmm. And as a result, I guess it's really working. But we've done dietary changes. We've done some neurological things with my vision and things like that. And we're doing some supplements.
Okay.
So that's
okay.
Pretty much what we're doing.
You're pretty pleased with what we're doing?
Oh, yeah.
Awesome.
Absolutely.
So if someone were to watch this, I'll get into more details in the description underneath, like what we're doing. But if you were to talk to someone's looking at this online saying, hey, I got pain all over, I got pain in my feet, or I'm seeing a rheumatologist and not getting anywhere, like any recommendations?
Oh, yes. I would say you better see Dr. Kushner. Yes, because like I said, in just this small amount of time, I'm really excited.
Oh, good. I'm glad to hear that. Perfect. Thank you very much.
You're welcome.
And that's good.